Good afternoon. I'm Dick Kell, Chairman of the Warren Centre Humanitarian Engineering Hub, and it is my pleasant duty to welcome you all to this webinar on research in humanitarian engineering, inspirations for the future. Let me commence by acknowledging the traditional owners of the land and lands on which we meet, wherever that may be, and pay our respects to their elders past, present and future. This webinar is being conducted by the Warren Centre Humanitarian Engineering Hub, which is an organisation which provides a forum designed to promote humanitarian engineering and international development and disaster response. It connects individuals and communities from government agencies, industry, academia, civil society, encouraging practical learning and collaboration across the whole spectrum of the humanitarian sector. Before I say something about the webinar, I'll give you the rules, which are fairly simple, just two. I remind you that the event is being recorded and that our schedule has time for questions at the end of the presentations. Please use the Q&A function to pose your questions and comments, and our panelists will address them all, or at least as many as possible in the time. The webinar today features 3 research projects. Research is fundamental to knowledge advancement in all branches of engineering and applied science, including, of course, humanitarian engineering. New ideas and expanded knowledge make the planning and delivery of international aid more effective, sustainable and relevant to the recipient countries. The Warren Centre encourages involvement of students and researchers in humanitarian engineering, notably via 2 annual events which we conduct. The Innovation Hackathon for undergraduates. This year we had over 200 students from 18 universities, including universities from New Zealand and the Pacific Islands, competing to solve challenges set for them in this year. The theme was the Zero Hunger SDG, or food security, working over a weekend in July with some wonderful solutions, which are have now been posted on the Warren Centre. The winners were announced on Tuesday evening this week at a gala function. The second competition that we run is the pitch competition for postgraduate researchers. The winner of this competition gets a trip to Honolulu, apart from some prize money, gets a trip to Honolulu to present at the huge PTC conference. Our 3 speakers have all won awards in the pitch competition. The 2025 pitch competition closes in shortly, but if you are a researcher, you still have time to enter. We plan to continue to promote or to provide a platform for postgraduate researchers as a regular event in our annual calendar. Today we have 3 researchers from the University of Sydney, humanitarian major in the civil engineering school, and in future we'll invite researchers from other universities. And in acknowledging that these 3 are from Sydney, I acknowledge the 2 senior lecturers in humanitarian engineering, Dr. Jackie Thomas and Dr. Aaron Opdike. I will now invite the speakers to make their presentations. The notice for this webinar includes bio notes for your information, so I won't repeat all of these. Our first speaker is Emily Nabong. Emily undertook her initial studies in the USA, and she has experience in the field, including with the US Peace Corps and the ADB. She recently completed her PhD in humanitarian engineering and was the winner of the 2024 pitch competition. Emily will speak on a practical tool for evidence-based climate adaptation planning. Emily, the floor is yours.
Yeah, thank you very much. I'll go ahead and share my screen. Okay. Looking good, I hope. All right, cool. Well, I'd like to first just start off by thanking Dick and John for the invitation to present today. I'm excited to share the work that I've been doing as some of the culmination of my PhD work. So again, hi everyone, my name is Emily Nabong, and today I'll be talking about an interactive tool that I developed as an output of my PhD research. So this wasn't part of my thesis directly, but it was my way of handing back some of the work that I did with my partners who helped me and contributed to part of my research. So this interactive tool is, I think, a fun and engaging way of not telling people the results of the research, but letting them test out different policies and draw insights themselves. So it's towards the goal of trying to facilitate more locally driven solutions to problems that are based in evidence and rigorous science. So setting the scene for this research, I developed a simulation model that lets us analyze the effects and impacts of climate change in the Pacific. So this research really stems and looks to address some of these big questions and headlines that we see when we see news about the Pacific, where we see predictions of uninhabitability, doomed countries that are threatened by rising seas. So in this research, I was really interested in diving more into this idea of what does it really mean to be uninhabitable, and how can policies help us to mitigate some of these dire forecasts? So specifically, I was working with partners in the country of Kiribati. So this is a country located to the northeast of Australia, and it has 32 atolls and 1 coral island. And in Kiribati, there's population pressures along with sea level rise, salinization, and other hazards that put climate change and adaptation really at kind of the forefront of their future planning initiatives. And so we know that climate change is an urgent problem for places like Kiribati and others in the Pacific, and there's a pressing need to adapt. However, we also know that problem solving that we use today should also incorporate foresight into how these solutions might impact tomorrow. So it's complex problems like this that I think tools like system dynamics modeling can really help us to untangle and guide strategic long-term policy strategies. So practically, as a researcher, what I wanted to develop was a tool that can help make the power and the rigorous science behind the system dynamics model accessible for people who are interested in long-term thinking, but maybe don't have the time to sift through a bunch of reports and data. Specifically, I was looking at groups like government officials who want to make informed policy decisions, but maybe have their time already committed elsewhere. So how can we feed back this research in a way that's easily and quickly understood to be used? So the tool that I developed in my work was it was a quantitative model that was built from qualitative discussions that I did with local partners in Kiribati. So in my research, I really tried to emphasize the importance of engaging and co-developing with local partners to make sure that the model was really grounded in the lived realities and experiences of people who are experiencing the impacts of climate change in Kiribati. So during my PhD, I tried to better understand these impacts through interviews, through a workshop, and also reading other scientific literature and reports and integrating those into the model. So just to give you a quick example of how I incorporated some of these different resources into the model. As an example, here's an excerpt from a report from the Asian Development Bank, where we read about how much of the population and a lot of the issues in Kiribati are centered in the capital of South Tarawa. So as funding agencies are looking to address issues for a large swath of the population, they'll look to places like South Tarawa to try and hit the largest amount of people as possible. So as they try and address these problems, the appeal of living in South Tarawa increases, and then the population grows as people choose to live there. So this is creating a reinforcing feedback loop. And on the other side, in more rural islands, this is a quote from one of the interview participants that I talked to, where they talked about how based on their perceptions, the outer islands may be getting forgotten in some of this development, where there's not that same investment towards services and infrastructure as we see in South Tarawa. So what we see is that this disinvestment or lack of investment creates another reinforcing loop, leading to people choosing to move and live in South Tarawa. So what we can see and what we can expect from these two reinforcing feedback loops is a high population growth in the capital based on the current system structure of prioritizing investment to specific areas. And this is just one example of how I've tried to integrate the qualitative data to set up the structure of the model. But given the time, I think that I will just go ahead and give you an idea of how this looks like in the actual interactive model. So I included a QR code at the top here. Feel free to scan that, and it will take you directly to the interactive tool that I developed, so you can go in and toggle and play around with this tool yourself. But in general, this is how the tool looks, where on the left side, we have some toggles that can let us switch on and off different policies. And we have sliders to adjust the magnitudes down here, if you can see my mouse. And then on the right side, we have the results. So we can see in real time how these different changes to the proposed policies will create change in the future. So if we start by looking at an example of water deficit, or how much water is lacking based on the needs and supply. So if we run these values as is with the current use of rainwater tanks, is it running? Yeah, we can see that as we run it, we can see that as the century goes forward, we might expect to see a large increase in water security, water insecurity based on the population demands and the current structure of the system. But we can also, Kiribati is also in the process of building and onboarding some desalination plants in South Tarawa. So if we test out, say, turn on the desalination toggle and then rerun the simulation, now we can see that the results for adding 2 new desal plants would decrease the amount of water deficit that we would expect in the future. And then we can also change things like the desal rate and see how that affects the future as well. And as another example, we have, we can look at the land area in South Tarawa. So similarly, if we try and simulate the impact of sea level rise on land loss, we can see that later in this century, we would expect a decline in land area. But we can also test out how things like reclamation can stabilize or increase land area based on how much we look to reclaim. So if we turn this slider and let's say 0.2 square kilometers per year of reclamation rate, and then resimulate it, we get a good idea of how that will contribute to the land area in the future. So that's only 2 examples that I have here. But in the future, I would love to include other metrics such as housing, health, income, which are in the model, but not currently in the interface. So I think that one of the benefits of using a tool that's based in system dynamics is that it includes a lot of these different aspects, and it includes a lot of different sectors, so that when we try out and toggle on different strategies, we can see not only how it affects what we're directly trying to affect, but also how it relates to other things that maybe we weren't expecting. So it has the benefit of hopefully helping us to avoid actions that benefit one area, but unintentionally harm other areas. And I think that this tool is specific to Kiribati at the moment, but I think the idea of an adaptation planning tool like this is something that could be transferable with the right contextualization for other places to help with policy planning around the world. So that's what I have for my research. So I'd be happy to take questions at the end of everybody's presentations, but thank you all for listening.
Well, thank you very much, Emily. That's very, very clever. and I'm sure there'll be you would be able to take this further with further research. It's that interactive, very clever interactive tool. So thanks very much. We'll see what questions that might bring.
Yeah, thank you.
And I remind people to post their questions on the Q&A function so that we can address them when we finish with our three speakers. Our second speaker is Sabita Adhikari. Sabita's initial studies were in Nepal, but she recently completed her PhD at Sydney University with research on rural sanitation systems with a focus on Nepal and Fiji. Sabita was second in the 2023 pitch. We're not seeing Sabita there, but no doubt she will come on. Sabita will speak on the work she did on understanding microbial contamination at the latrine front ends, insights from Fiji and Nepal. So, Sabita, over to you.
Yeah. Let me share my screen. Yeah. Thank you again. I'm really glad to be presenting here with my colleagues Emily and Arvin, and thanks Richard and Joan for organizing this webinar. So again, hello everyone. My name is Sabita Adhikari, and I'm presenting a tiny portion of the my PhD work that I did for my past 3.5 years in School of Civil here at the University of Sydney. I would start with the acknowledgement of the country. I'm currently in the traditional, on the land of Gadigal people of Eora Nation, and I pay respect to all elder past, present, and emerging, and also acknowledge the traditional owner of Fiji and Nepal, where I had an opportunity to conduct my research. So starting with the bigger problem, we know that having access to basic sanitation facilities, having a toilet or latrine is a basic human right. Yet, in many parts of the world, lack of access to these facilities, such as toilets or latrines and hand washing facilities, cause transmission of several infection diseases like diarrhea and typhoid. And this risk is higher in the countries with lower and middle income countries, and even in some high income countries. And with further risk to vulnerable groups such as women and children. And to address this, the SDG 6, as we know, particularly 6.2, has indicators to provide adequate and equitable sanitation by 2030, and my research revolves around SDG 6.2 particularly. So when we talk about the rural sanitation system, this is a simple schematic where we have a toilet or a latrine building on the front end where the user goes and uses the toilets, and then we have the back end that can be a simple pit, or that can be a septic system. And this is an on-site system where it is not connected with the sewer. So while many research and studies in that have looked into the microbial contamination or had evaluated the microbial risk in the sanitation system, has focused more on the contamination that comes from the fecal sludge leaching and contaminating the groundwater, or from the leaching of the fecal sludge from the containment system, or even through the consumption of different, unwashed vegetables that are contaminated. But when you look into the literature in sanitation and hygiene, there are very limited studies that have really conducted the studies on the front end or the latrine in the latrine of the household latrines. While there are some studies in the public latrines, when I did the literature review, we only found only 10 studies that have really quantified the microbial contamination in the field. And there were none from the Pacific countries as well. So it shows a significant gap of understanding how these existing latrines are being used by the household in the rural communities. So the research objective, and particularly tailored for this presentation today, is to see what are the different high-risk pathogen transmission pathways in the latrine surfaces, and also really to explore what could be different factors and behaviors that are impacting these transmission pathways. And we look into the insights from Fiji and Nepal. So as I mentioned, we have case studies from Fiji, which is a Pacific country, and then Nepal, which is a South Asian country. And I'll come into later how these two distinct geographical settings have different latrine infrastructure and behavior as well. So while both of these countries have done tremendous progress on having access to the facilities or having access to the toilets, both of these countries still suffer with fecal oral diseases like typhoid and cholera, and these diseases still claim lives in these countries, which shows despite the access, the countries are still struggling with the fecal oral infections. So coming back to the case study in Fiji, it was a part of this bigger project called Watershed Intervention for Systems Health in Fiji, called Wish Fiji. So this project covered 29 rural communities in the 5 catchments, which are shown in these green colors in the figure. I also conducted the in-depth sanitation sampling in one of the communities with our research partner in the field, which was the Fijian National University. And in terms of the toilet types in the communities that we studied in Fiji, so they are basically the cistern plus pedestal type, like the toilets that we see in here in Australia. There were also the pour flush latrine, where the bucket or the containers are used to flush the toilets, and some of them were also the pit latrine, which is connected to the pit underneath. And in all these latrine type, the household were using the paper-based anal cleansing, meaning that they were cleaning themselves using the toilet papers or newspaper also after the defecation. And in terms of Nepal, this was conducted in a rural municipality called Chakamana, which is a rural municipality and west of Kathmandu. And we used the existing national water sanitation, hygiene, and wash data to understand the contextual, the infrastructure of the toilets and also the users' behavior in those communities. And I again conducted the in-depth latrine sampling in 1 communities in that rural municipality as well. And what's interesting in Nepal was the toilet type or the latrine type is mainly pour flush and squat type. So there are some pedestal type toilets, but the predominant one is the pour flush, where the user would flush the toilet with using the buckets, and the squat type toilets are pretty common. And in terms of the latrine users' behavior, Nepal is predominantly based on the water-based anal cleansing, where people will use the water and their hand to clean themselves. And it is also related with some socio-cultural norms in Nepal. So when designing the sanitation tool, I collected the data using the sanitation household survey, also did the detailed sanitation observation, and the main sampling for the microbiological sampling was done by measuring the bacteria called E. coli. So E. coli is a bacteria that measures the fecal contamination in any given sample. So these were 3 different tools that were being used in both countries. So just giving some snapshot of the samplings. So I conducted sampling in Fiji in 12 household latrines, and in Nepal it was on 8 household latrines. So in the figure you could see like different sampling locations that I sampled to get the to quantify the fecal contamination in those surfaces. Sharing some examples and some pictures of the field sampling. So the E. coli with this bacteria was counted, for example, these blue colonies in it was cultured, and the blue colonies are the bacterial colonies and were measured in the colony forming unit, which is the way to measure the bacteria. So coming now to the results in Fiji. So when I analyzed all these samples of E. coli in the latrine surfaces, we found that the frequency of the positive E. coli samples were highest on the latrine floor, and which was quite expected. And we see in this picture, the y-axis shows the concentration or the density of the E. coli, and then the different sampling locations on the x-axis. So when looking into the concentration of the E. coli density, we again found that the latrine floor had the highest E. coli, which are followed by latrine seat and also the midwall. But now in Nepal, the frequency of E. coli sample were higher on the squat plates, meaning that on these white squat plates where the person would go and squat for the toilet. And interestingly, so the dipper handle, for example, this blue mug or dipper that is used to dip the water from the bucket for anal cleansing and flushing, also had the highest frequency of E. coli samples. And when looking into the concentration or the density of E. coli, again, the squat plate had the highest concentration, which was followed by latrine floor, and then again, the dipper handle. So this is the overview of the concentration that was reported in the surfaces in these two case studies. But again, in Nepal, because Nepal is a country where water is used for both flushing and anal cleansing, we also collected samples from the water that was stored inside the latrines. So we found that the E. coli in the anal cleansing and flush water was significantly higher than the tap water or the source water, which shows the unsafe handling. And when I went back and looked into the ANWASH data, we also saw a pattern that the household were putting the dippers into the latrine floor and then using that one to dip into the water, which can be one pathway for the contamination of the anal cleansing water. And also analyzing all the pictures and coding them, we saw that the anal cleansing hardware, such as this bucket and dipper, were really overlooked and a neglected aspect of sanitation and hygiene, where they were not cleaned properly, and which came out of the analysis of the pictures that were recorded in the survey. So this contamination in the anal cleansing water and flush water, it is not only risk for fecal oral infections, but it also has an implication for the urinary tract infections, which is primarily caused by this bacteria E. coli. And this can disproportionately affect women and children because in a lot of this water is also used by women and girls to clean themselves while they are menstruating. And also in a lot of in those countries, women and children are the people who are managing the water and filling the buckets in the toilets. So this risk can disproportionately affect them as well. So when coming back into the main finding in Fiji and Nepal, we found that the surfaces that had visible moisture and the dirt on the surfaces were significantly associated with the higher E. coli contamination. But the factors for those presence of the moisture and dirt were quite context specific. For instance, in Fiji, a lot of moisture that came in the latrine surfaces, particularly on the floor, was through the leakages from the cistern and the broken pipes. So there was a lot of maintenance issue. Around 40% of the 311 households had something broken in the toilets, which shows the maintenance issue. And there was a lot of accumulation of the dirt on the floor as well. And we also observed a pattern that some households were starting to use the cistern plus latrine into a porous latrine because the cistern was broken and it didn't work. While as in Nepal, having the squat design of the toilets and using water-based anal cleansing made it quite tricky to have the surfaces dry. So the surfaces were wet all the time in the day. And we also saw the lack of cleanliness, particularly on the anal cleansing hardware and the containers. So this shows that in both contexts, the infrastructure-wise, so this household has the infrastructure criteria met for basic sanitation facilities, and they have access, but there is still the need to focus more on the cleanliness, the maintenance part of the toilets, and also the hygiene practices. So how this research can have impacts in the local level. For example, in Fiji, this can inform the local water committees, particularly on maintenance of the toilets. And in the national level, the organizations and people working in water sanitation and hygiene sector, this information can be used to design more targeted and sanitation and hygiene interventions. And similarly, Fiji has been now into second phase of the project, Wish Pacific, and this finding will also inform the design and intervention in the Wish Pacific as well, which is more on the regional implementation. And in terms of Nepal, when I went back to the communities and shared the findings, so the local health facilities were really interested on using these messages in their public health campaign, and it can be a complementary message, particularly focusing on the cleanliness of the anal cleansing hardware. And similarly, national government and the local government and even the NGOs working in WASH have the checklist for sanitation indicator in Nepal for the household for safe latrine. So the information from this research can also inform those sanitation indicators. And it can also, as I mentioned, it can also inform the national indicator in Nepal within the WASH MIS system. So to have this bigger picture, I always have this slide to summarize my thesis altogether. So when I was particularly looking into the very microbial level of the latrines or the toilets, but the aim was really to have a safer household so that there is a safer community, which creates a safer world altogether with one clean and safe latrine at a time. So thank you everyone for listening. If you want to go through the publications, here's the link to my QR and some pictures that I really enjoyed from my fieldwork in Fiji and Nepal, and also my QR code if you want to connect to me in LinkedIn. Thank you so much.
Well, thank you, Sabita. That was a very important research you've undertaken, and you clearly displayed remarkable perseverance. It's not an easy thing. I know from my long experience in rural areas in developing countries that the toilets are quite often a turn off, but you persevered and you got the data that will enable major improvements and with significant health benefits. Well done, you. So we'll look at the questions later. So we'll move on from Sabita to our third speaker, who is Arvin Hadlos. Arvin completed a master's in architecture in the Philippines before coming to Sydney to undertake his PhD in humanitarian engineering at the University of Sydney. He recently completed his PhD, and Arvin won the 2023 pitch competition from a very, very tight field, which included Sabita, incidentally, who came second. So Arvin will speak on housing safety and analysis of non-engineered structural assets in resource-constrained communities. So Arvin, the floor is yours.
Yep, thanks, Richard. So I'm just gonna share my screen in a sec. Can you look at my slides? Yep. So thank you everyone for joining. So my name is Arvin and I'm a recent PhD graduate at the School of Civil Engineering at the University of Sydney. And today I'm going to present a portion of my broader PhD work entitled Housing Safety Analysis of Non-Engineered Structural Assets in Resource-Constrained Settings or Communities. So before I begin, I would like to acknowledge the traditional owners of Australia, and I do acknowledge that the campuses of Sydney Uni stand on the land of the Gadigal people of the Eora Nation, and I pay my respects to their elders, past, present, and emerging. So I'd like to start by introducing the big picture problem. We do know that disasters bring considerable damage to societies and communities, and if we look at the plight of housing assets, we can see here that the escalating disaster impacts will continually damage 167 million of houses globally. And within this statistics lie the cases where communities need to rebuild their houses following disaster impacts. And in most cases, they would be relying on their resources, their capacities, or whatever are available around their surroundings in order to rebuild their dwellings. Thus, we have the term here non-engineered construction or non-engineered houses. And they are non-engineered in the sense that traditional building codes would not cover provisions for them to be considered as safe, and thus we are clueless about how they will likely perform in the event of disasters or calamities. So there is an imperative to explore risk reduction strategies for informally built housing assets. But before we can further move into this one, there is this crucial activity that we need to first understand housing performance. And one of the ways to do that is through the derivation of fragility functions, which basically visualize the relationship of hazard intensities and damage probabilities. So to conceptually demonstrate this one, just imagine that there is an increasing intensity levels, as you can see here from left to right. That could be an earthquake hazard, depth of flooding, or extent of bushfires, etc. And then from top to bottom, or the y-axis, just think of the lower end to be low probability, and towards the upper end, like the highest probability. So that's from 0 to 100%. And from here, we can map different damage states, from minor damage, which we can conceptualize as, for example, for seismic, that could be non-structural cracks, and then we can progress to map moderate damage up until towards the end we have a complete damage, where we can think of this as a house or structural asset being in a collapse state, wherein you cannot anymore just repair it, but rather you need to completely rebuild this one. And if you look at strong intensity, we can infer here from the fragility functions that there is most likely 98% probability of that house experiencing or being in a complete damage or a collapse state, and very low probabilities that it will enter into moderate or minor damage. So the question here, the million-dollar question here is that how do we create fragility functions? So there are three means, like if we have the computational or analytical resources, we can do simulations, but this can be very resource intensive. And we can also rely on empirical means, which is based on past damage data. However, if we don't have computational resources, or that we don't have records of past reconnaissance reports that will give us past damage data, we are left off with using what we call an expert-driven, which is based on experts' opinion, and this is the most practical option when we are looking at the context of resource-constrained setting or communities. Like the case of Itbayat, where I've focused my PhD research on. And in this work, we've analyzed earthquake and typhoon hazards, so we've derived fragility functions corresponding to these hazards. And in Batanes, in the Philippines, which is my case study context, this is the ancestral domain of the indigenous people, so they've developed a specific vernacular construction methodology through the use of stone and lime houses to safeguard them from wind impacts. However, in 2019, a series of earthquakes crumbled all these structures. So moving forward, communities decided to build very differently. They relied on contemporary construction materials and methodologies, and these are all non-engineered. Again, they're not covered by building codes and whatnot, so we don't have an idea on how likely they will perform, whether they're structurally resilient or not. So in my work, part of my work, we've identified the housing typologies after the 2019 earthquakes. So we did a rapid visual surveys within the community to identify like what are the types of houses that the communities built after the 2019 earthquakes. And after which we have solicited experts' opinions using an established method from the Applied Technology Council, which is a US-based firm. And then we've included local experts or the engineering professionals based in the province of Batanes, where the municipality of Itbayat belongs to. And we've also invited specialists or those who have engineering background who have also an idea about housing performance damage analysis in the context of the Philippines. So the survey looked something like this. I'm just gonna quickly run through them. The first one is that we provided the characteristics of the surveyed housing typologies. And then we have operationalized damage states. So this is what minor damage means. For example, as mentioned earlier, non-structural cracks can comprise minor damage, the complete damage being considered as in a collapse state. Then we've asked experts to put in their estimates about what specific hazards or what levels of hazards will incur the specified damage states corresponding to the presented housing typology. And towards the end, we asked the experts to present their confidence level regarding on their estimates, as this was used later on for the weighting processes in collating all of the experts' estimates. Now, to run through with the results, I'm gonna first introduce the identified housing typologies. So after the earthquakes in Itbayat, Batanes in the Philippines, the indigenous households create one version like this, wherein it's entirely made of lightweight materials, or specifically the corrugated galvanized iron sheets, which I will be referring to as CGI. You can see here the walls and roofs are made of CGI. Similar to this one as well. This is another variation. Then there's also a typology wherein the lower part of the wall envelope is made up of reinforced concrete, and the upper part is made up of lightweight, which is CGI or the corrugated galvanized iron sheets. And this is also another version of that. You can see that reinforced concrete is comprised the lower building envelope or the wall envelope, and the upper part is more lightweight. And then there's also a typology wherein the walls are completely made of reinforced concrete. However, the roof cover is made of lightweight galvanized iron sheets. And the last typology is an entirely reinforced concrete typology, where as you can see in here, even the roof is made up of reinforced concrete, which is a slab roof. Now, for each of the typologies, I presented earlier that we've used this one for the surveys and we've derived fragility functions for each of these. However, in the interest of time, I'm just going to show you one example, and that is the fragility functions for earthquake and typhoon corresponding to this typology, which we will code as RCB. So to the left image is earthquake fragility, and to the right is typhoon fragility. Now, if you're looking at the earthquake fragility, for example, we're interested in looking at intensity 8 earthquake, which is pretty extremely devastating. And if we're interested in looking at the red line, which is the complete damage, which again, to reiterate, it means that the house will be in a collapsed state. You cannot anymore rebuild it. You cannot anymore repair it, but rather you need to rebuild it entirely. And we can project here that there is roughly 50% or close to 50% that the house, the reinforced concrete house with slab roof, will experience damage state at this hazard intensity of earthquake. Now, on the other hand, if we're looking at the typhoon fragility, say for example 300 kilometers per hour, which is a wind speed that can correspond to an already super typhoon case in the Philippines, we can see here that the RCB is more resilient, mainly because that there is way lower probability. That's around, I'm guessing this is 5 to 8% probability that RCB will experience complete damage or will be in a collapse state once this hazard intensity is experienced. So just some of reinforcements or caveats. We've used the expert-driven approach mainly because we have data limitations in resource-constrained context. However, moving forward, once we do have computational resources or that we can get access or have past reconnaissance reports so that we can model fragility functions based on the other means that I did discuss a while back, then we can combine all of this. And in my work, we've identified or we've generated the fragility functions, the first generation fragility functions for the case study site, mainly because we acknowledge that there are geographical differences of construction methods, and that can influence the housing performance of a structural asset. And we also want to highlight that there is the uniqueness of the emergent typologies. So last slide, next steps, where does this fit into or what are the practical implications? So fragility functions generally are used to estimate direct economic loss. Like you build a house and there's a specific monetary value. Now, if a hazard comes in, it destroys your house. How much did you lose? So that's what we call the direct economic loss. And part of my continuing, with that, I continued my PhD work with analyzing the direct economic losses on a community level regarding to the impacts of wind and seismic. And then I was looking at the trade-offs on rebuilding considering both impacts of hazards. I guess this is a very technical explanation, and I've omitted much of the technical details in here, but if you're interested, here is a published work referring to the derivation of the fragility functions in resource-constrained settings. And if you have any questions, I'm happy to answer them at the end of this presentation. Thank you very much.
Well, thank you, Arvin. That was very interesting. As a structural engineer, I was quite taken with that. Very impressive. So we'll now move to the Q&A. And I remind people again that if you do have a comment or a question to any of the speakers, please post it on the Q&A function. So we can go there, and we see that someone was not seeing Sabita's screen. We'll hope that that was fixed. From May Newey, we have a question for Emily. In your research, have you encountered the risk of paucity of data? Is there a risk of insufficient data inputs for your model? And do we have to help influence agencies to have the appropriate data collection in place?
Yeah,
So,
thank you,
Emily.
May, for that question. That's a really important question. And I think that as a modeler, we always want to have more data. Sometimes it's just not available. In Kiribati in particular, I did run into a lot of issues trying to find good data to use in the model. But I think that for the model, even though some of the variables that I used were with assumed values, how I kind of approach it is, I know that if I don't include those variables in the model because of a paucity of data, then it just kind of zeroes out that variable and it doesn't consider it at all. So I think even using assumed values in the model is better than not including them at all. But I think that goes to your second point of trying to advocate agencies for, where did it go? Yes, there it is. Helping to influence agencies for better data collection. The more we can collect data for places like Kiribati, the better we can simulate the results and have a better understanding of how that will affect the future. So yes, I think that the more data that we can advocate for, the better, the more we can increase our understanding.
Yes, thank you, Emily. Of course, it's always an issue with getting data collected costs money, and either the agencies or even the banks may not consider it as worthwhile expenditure. So probably an organisation like our hub should make that point to those responsible, that as with all three of these research projects, the acquisition of data is absolutely vital and will lead to significant benefits. So thank you, Emily. We have a question for Sabita. I think you can see the question, Sabita. Can you make a survey of latrines that was cleaned by water only or by chlorine solutions? And Mr. Tyring has given percentages of the chlorine solution. It could be very beneficial to know the bacterial E. coli of these conditions. I just returned back from South Sudan on a cholera outbreak and would like to know how your research can contribute to my work in WHO and UNICEF. I've been to Nepal and led the NWASH survey and been to Fiji on sanitation promotion. So you've got a fellow researcher here.
Yeah. Yeah, that's a great question. Thanks for the question, Tyring.
Yeah.
So yeah, is to answer, like, did I do the survey using only water and after the chlorine solution? So within the scope of my research, I didn't really test the latrine surfaces that is cleaned only with water or with different concentrations of the chlorine solutions. But what I can say based on the literature that I went through during my research is that definitely the chlorine solutions will be able to help to reduce the E. coli concentration. And there are even researches that shows that even if there are no the disinfecting agents like chlorine available in the rural communities, even wiping the latrine surfaces with the detergent or the soap can reduce the bacterial concentration by 1 log, meaning like 90% in the first wipe, and it can further reduce with like more wiping done in the surfaces. So there are these simple things that we can do, and my research really focuses on not having like only one solution. So it's kind of it recommends more like a multi-barrier approach where we need to prioritize latrine surface and cleanliness, but also the infrastructural maintenance of the latrine or the toilet itself, and also the hand hygiene. So it's kind of like a different small things that comes together as a multi-barrier approach. And yeah, I really am interested to maybe have a chat with you. It's really interesting that you have been in Nepal as well. And yeah, like I would love to connect and maybe in LinkedIn and talk further about your research or further about your work and how I can contribute to your work as well.
And Fiji as well.
Yeah, yeah.
There, so very interesting. Tell me, have agencies or authorities been picking up on your work and perhaps introducing some of the, I might say, simpler approaches of relating to hygiene and putting notices on walls and to request people to act in a certain way? Are those things being picked up?
In terms of Fiji, like when we disseminated our findings, it was through the local Fijian catchment coordinators, through our research partners in Fiji, and also the principal investigator. They had disseminated. There was this big government stakeholder meeting where we disseminated these research findings. So hopefully, this context on cleanliness would be picked up as well, and we definitely can see progresses in Nepal as well, where when I went back to the communities, the organizations working there were really interested on having these indicators in their existing work. So I definitely see the organizations picking things up, but I think there's a lot to do on advocating about it.
Yeah. Okay. Moving on with the questions, and Thai Turing has one for Arvin. Structure damages by earthquake and typhoon are different in nature. Does your research cover where the weak points are for either of the hazards? So,
Yep.
yes.
Thank you for that question. So the way that we've conceptualized the survey was on a separate basis. So we did a survey separate for each hazard for earthquake and then typhoons, because we do know that the damage mechanisms corresponding to each hazard is very different. So just to give you an idea, for earthquakes, we focus on operationalizing the damage states. Depends on the cracking patterns, such that hairline cracks could be considered minor damages, and then like structural cracks would be part of the complete damage state. Whereas when we talk about wind impacts or typhoon impacts, this has more certainly has to do with the envelopes or the wall envelopes. For example, we've categorized complete damage, operationalizing that the roof cover is more than 75% being lost in a wind event. So it wasn't combined. That's why the next part of my thesis was more like creating a tool into interactively analyzing the trade-offs when we're rebuilding multi-hazard, because this is a bit of a tricky problem, given that the way that the damage mechanisms for these hazards are very polarized. Sometimes that when you address earthquake resilience, you might be impacting typhoon resilience, and the other way around. So that was the next part of my thesis. But yep, we did cover them separately.
Yes, yes, good question. That was a good question, and I think you've answered that. That they can be separate. concrete building may perform well in a cyclone, but may not, depending on the detailing, may not perform very well at all and can be quite disastrous in an earthquake. Arvin, I presume there are standards, building standards that specify requirements for the design and the construction to withstand cyclones and earthquake, but would it be that in rural housing these may not be followed because they would tend to follow traditional methods so much because of the cost and perhaps lack of knowledge of what is specified? But there are standards, I presume.
Yeah, that's exactly the point. That's why the phrase here is non-engineered construction, because even though there is unenforceable regulations, communities won't be able to follow that, especially in the context of post-disaster situations wherein it's a very high pressure environment. You just need to rebuild as quickly as you can to shelter your families. And then sometimes like permit processing in order for you to have a resilient house following the standards prescribed from the building code would take you months. So it's a bit of a gray area on whether should you follow the code or should you rebuild quickly. And of course, cost is also one of the factors.
Yeah. Okay, and I see the next question from Sarju Abraham is for you, Arvin. It's along the same lines. Is the reason for the RCB resilience lowered in an earthquake situation due to the weight of the roof, the reinforced concrete roof? I think we just touched on that. And did the building with a timber frame roof perform better in both earthquake and wind conditions?
Yep. Thank you for the question. So we can say generally that the trend is like the lightweight typologies would perform worse seismically, and then heavier typologies would perform better against typhoon impacts. But there's also like the nuances when we're considering moderate damage or minor damage, etc. And in the publication that I've just shared you the link there, once you go through the different fragility functions, you can see there the patterns of the different damage mechanisms of a specific typology corresponding to specific hazard. But yeah, to summarize, we could agree that that's the trend.
Thank you. And the next question is to you from Stephanie Hamel. Did you have a chance to compare your data with performances of traditional houses in the Philippines as a different housing typology?
Yep. Okay, so good question. And I think I've framed my presentation that we derive fragility functions of the housing typologies after the earthquakes. But what I didn't emphasize was that we've also created fragility functions for the traditional houses or the stone and lime houses, which was considered as a baseline for my research. So to answer that question, yep, we've compared it. And in terms of earthquake, as what we would expect, it didn't perform really well. But in terms of typhoon impacts, it performed similarly to the range of how resilient a reinforced concrete structure would be. So for more information, you can look at the publication, and then there is a dedicated fragility functions for the stone and lime vernacular typology or the traditional house, which was constructed by the indigenous peoples in Itbaya.
Thank you, Arvin. We have a question from Sarju Abraham again, but this one for Emily. I work on a number of projects in Kiribati and in particular in South Tarawa. My question, I find the tool useful, but with regards to reclamation was consideration, this is the reclamation part of your model, was consideration given as to where material would be sourced from and the impact this may have with regards to land and population growth rate. We see the growth in land area at a more domestic level with a large use of household rubbish to generate fill. So, Emily, do you have a comment on that?
Yeah, really interesting question and comment, Sarju. Thank you for that. So in the model, the reclamation was actually an exogenous variable, which means that it was input externally. But I think that's a really interesting point about the more land area, the more household rubbish that could be used to generate the fill, which could be another really interesting feedback loop to add into the model. But yeah, it is important to think about the sourcing for it, because I know a lot of the people that I had talked to, they were saying that previously maybe they've been dredging out of the lagoon, which creates some more issues with erosion on the lagoon side of the atolls. Yeah, really interesting points and things that I think would be probably next steps for the model if I was looking to make it more rigorous, is adding more feedback loops, like where the reclamation is sourced from. So thank you for that comment.
That's all the questions we have at the moment on the Q&A. Emily, whilst you're there, can I ask you what further measures were you contemplating? You looked at land reclamation and water, the water supply. For instance, another climate impact that it is increasing is the severity of cyclones and the sea surges resulting from cyclones. So you may be able to link up there somewhere with Arvin's work in that regard, because he's examining the impact of cyclones on housing as a fragility function. So have you contemplated further measures that you might look at, or factors?
Yeah, so the current hazards that I have in the model, based on just conversations that I've had and some research that I've done on Kiribati, currently it looks at precipitation variability, temperature, and sea level rise. So those are the ones that are currently in the model. I think that for the next steps in the model, what I might try and integrate are, so I recently went back to Kiribati in January, and I presented this model and this interface to some of the partners that I worked with, and I asked them, what would you hope to see added to this model? And they had some really good thoughts on what they would like to see additionally added. They were talking about how they would like to see things like maybe how could government subsidies, for example, if we were looking at the population growth inside South Tarawa, they were saying that they were interested in seeing how subsidies to live or maybe work in the outer islands could affect the internal migration between the islands. So that's something that I think would be really interesting to add to the model. What else? I also have some indicators in there for household density, which is kind of related to that idea of densification in South Tarawa. Yeah, so those are some of the things that I'd be looking to add to the model.
Good, thank you. We do have a question, and I think this would apply to all three speakers. It's directed at Emily, but I think it will be all three. How can I access your findings? John Donohue's, I think, back with us, and we do make the presentations available, but you might just address that, John, if you wouldn't mind, and because each of the presentations had references to the research work.
Yeah, well, generally we just liaise with the inquirer and the researcher and make sure they want to be able to share their research. It is still their research, even if we have your slides. And you can reach us at the Warren Center through the hub, which I had the link and now I've lost it because I was copy pasting something else.
Yes, if you could provide the link. John, are you still doing something?
Yes, I'm trying to type in the Warren Center, but I'm failing at typing in internet.
Mm.
There we
Do,
go.
do we have
Okay.
the address of all those who have attended this webinar, John?
Generally, if you've registered, we have those email addresses, but people don't have to give up their email address when they're joining Zoom. Necessarily, it's up to them. You can reach us. Mm. This email address. Sorry, I thought I had a different email address, and I don't. And
so, for those people who are registered, which would include all those who attended, we'll send the link to you.
yes, the video recording of this presentation will be made available online on YouTube and sent out to all those who registered to view today. If you found yourself joining today and hadn't previously registered, you got the link sent through a friend, you can write to us at engineering.external@city.edu.au. The video will also be placed on the faculty's YouTube channel, so it'll be viewable there as well, unless Sabita or Arvin or Emily strongly object.
Okay. All right. Well, that will mean that via the emails of registration, we will connect all who registered up with the presenters. And as John says, the presentations will be on on YouTube. So I think that will mean that you can connect. I think all of the researchers all indicated that they would be pleased to talk with anyone who is interested in their work, and that can only be a positive. Okay, so we don't have any further questions as far as I can see. So unless someone has a question, I think we will call this the end of our webinar. And I will say this, that our upcoming events will feature webinars on a post-disaster water project in Timor-Leste, and on the impacts of sea level rises on Pacific Island countries. We'll centre that on Tuvalu, and Kiribati, of course, has problems, so we might have to come back to you, Emily. And so keep an eye on, we will advise all those who have been on our contacts and our members of those upcoming events. And if you are not a member of the Hub, then you are invited to join, and you can join via the email that John has posted on the chat. I believe today that we've had the benefit of 3 excellent, but all very different first-class presentations on very important and relevant research topics. Our panelists have informed us from the obvious depth of the knowledge they have gained and generated from their research. I think it is certainly proven the position that how essential and necessary research is, and how it takes us our knowledge further so that we can do better things in the humanitarian engineering space. The Q&A sessions were enlightening. Thank you very much for the way that you answered your questions, and thank you very much to those who posed them. So on behalf of the Warren Centre, I thank all 3 speakers very much. Compliment you again on your excellent research, and thank you for taking the time to present to us today. And that is all for now. I wish you well for the rest of the day, and please stay tuned for further information from the Warren Centre Humanitarian Engineering Hub. Thank you.
Thank you,
Thanks.
everyone.
Thank you.
Thanks.
Thanks, Dick Kell, for emceeing today as well. Really appreciate it.